Perceived learning quality in the time of COVID-19 pandemic, me and students' assessment of acquired competencies through online learning platform. Introduction.
COVID-19 pandemic had a huge impact on the lives of the people all around the world. It affects variety of institutions, especially educational institutions, which lead to suspension of face-to-face classes all around the world. It will change the teaching-learning process in higher educational institutions. The only way to continue is to adopt new normal education through online learning platforms. Some students are having difficulty surviving online class due to different factors such as financial problems, devices, and connectivity.
Ookla Speed Test 2020 mentioned that the Philippines has too slow and expensive internet connection and becomes the 84th spot out of 134 countries with an average broadband speed of 29.13 Mbps. It affects students and teachers since connectivity is the main source to adopt the new normal. Students graded based on the answered question and attendances, and it will not be fulfilled because of the loss of connectivity.
According to OSTOC 2013, Philippine government implemented policies to continue the education of the students, which includes modified forms of online learning that aims to promote students' activities. Online learning might be synchronous and asynchronous. Synchronous includes real-time lectures and time-based activities, while asynchronous includes delay time activities, pre-recorded lectures, and time-dependent assessment. The quality of online learning is based on the effectiveness of the students to learn using online learning platforms. Part of this platform is providing effective, adequate, ease of use, and access on the part of the teachers and students.
Theoretical framework.
The study is anchored from the theoretical support of the learning theories. Cognitivism by Clark 2018. The theory of cognitivism emphasizes how the mind works and acts in terms of thinking, remembering, perceiving, interpreting, reasoning, and problem solving. Behavioral psychologists believes that humans have the ability to respond easily to environmental stimuli, but cognitive psychologists believes that humans have the logical thought and can learn to active participation.
The history of cognitive theory is fascinating. It started with Plato and Descartes, who are the first philosophers to study the mind and behavior. J. Piaget is a prominent figure in the field of cognitive psychology. He is known for his work on developmental levels and his hypotheses on the environment. Through the use of cognitive learning theory, we have a better understanding of how the brain works. WGU 2020.
The theory of cognitive development according to John Piaget 2020 are caused by combination of two processes, assimilation and accommodation. Children are more often to understand by means of their experiences and then adjust their expectation. He explained that children tend to develop new ideas and concepts by reflecting on their previous experiences. Curt 2020.
The principles of cognitive learning are designed to help teachers develop effective strategies to support the learning process of the students' instructions that should be organized, clearly presented, and linked to a goal in a way that this would be meaningful to the learner. Learning is a complex process that involves acquiring and enhancing various external and internal factors that affects a person or a group. It is also concerned on how students use their brain to access themselves, develop, and how to use the knowledge in the classroom.
Statement of problem.
This study aimed to probe the epidemic perceived learning quality as they assess their acquired competencies through online learning platform in the time of COVID-19 pandemic. It specifically sought to answer the following question based on the 7 learning competencies: critical thinking, problem solving, managing information, creative and innovation, communication, collaboration, personal growth, and well-being. Number 1. How much learning competency does online learning platform provide the PDM students? Number 2. What is the level of competency do the PDM acquired online learning platform? Number 3. What is the PDM students' assessment on the quality of learning delivered through online learning platform?
Hypothesis of the study.
There is no significant difference between the perceived learning quality of PDM students from the College of Computer Studies and the College of Hospitality and Tourism Management, as they assess acquired competencies through online learning platform in the time of COVID-19 pandemic.
Results, analysis, and interpretation.
Table 1 shows the level competencies provided to the Batavian student from the College of Computer Studies and College of Hospitality and Tourism Management via online learning platform. In College of Computer Studies, communication has attained the highest weighted mean of 4, which interpreted as provided sufficient enough, while problem solving is the least competency with the lowest weighted mean of 3.50, which is verbally interpreted as provided sufficient enough. Generally, all competencies are sufficient enough as reflected in the overall weighted average of 3.73 in College of Computer Studies. For CHTM, the critical thinking and communication obtained the highest weighted mean of 3.71 and interpreted as being sufficient enough. On the other hand, problem solving and collaboration are the least competencies obtained with the lowest weighted average of 3.42 and interpreted as somewhat sufficient. In general, all competencies are sufficient enough as reflected in the total weighted average of 3.58 in CHTM. Table 2 shows the level of Epidemian's acquisitions of competencies provided by online learning platform. The level acquisitions of competencies of the Epidemians in College of Computer Studies shows that the creativity and innovation as well as collaboration attained the highest weighted average of 3.79, which was verbally interpreted provide a high level acquisitions of competencies. Critical thinking attained the lowest weighted average of 3.46, which was verbally interpreted as an average level acquisitions of competencies. Generally, all competencies provide a high level of acquisitions as reflected in their overall weighted average of 3.61 on College of Computer Studies, while in CHTM Managing Information attained the highest weighted average of 3.79, which was verbally interpreted provide a high level acquisitions of competencies. The collaboration attained the lowest weighted average of 3.33, which was verbally interpreted as an average level acquisitions of competencies. In general, all the competencies are provide high level of acquisitions to Epidemian student from CHTM with an average weighted mean of 3.60.
Table 3 shows the Epidemian's assessment of learning quality delivered through online learning platform. In College of Computer Studies, Managing Information, Communication, and Personal Growth and Well-being has attained the highest weighted mean of 3.68, which interpreted as provided good learning quality, while critical thinking is the least competency with the lowest weighted mean of 3.46, which is verbally interpreted as satisfactory in providing learning quality. Generally, all competencies provide a good quality as reflected in overall weighted average of 3.60 in CCS. For College of Hospitality and Tourism Management, the creativity and innovation obtained the highest weighted mean of 3.71 and interpreted as provide a good quality. On the other hand, collaboration is the least competencies obtained with the lowest weighted average of 3.17 and interpreted as providing a satisfactory quality of learning. In general, all competencies provide a good quality of learning as reflected in the total weighted average of 3.50 in CHTM.
Conclusion.
This study aimed to probe the Epidemian perceived learning quality as they assess their acquired competency through online learning platform in the time of COVID-19 pandemic. The researchers concluded that the online learning platform could be possible to normalize as a mode of learning provision of Epidemians as face-to-face classes are not already possible.